Hello and thank you for tuning in. In my last presentation, I shared with you findings from one study that showed that vegetarian or pregnant vegetarian women had a relatively low serum vitamin B12 level. I would like to follow up with this presentation, and this is the second of the series of presentation I'm doing on vitamin B12 in pregnancy and childhood. Let's begin with evaluating the data from this particular study published in the American Journal of Clinical Nutrition 24 years ago in 1990. Even though it was published that long ago, I believe it is still relevant for us today. Vitamin B12, low milk concentrations are related to low serum concentrations in vegetarian women and to methylmalonic aciduria in their infants. When these researchers stated here low milk concentrations, they are referring to mother's milk or breast milk. Okay? And when they say methylmalonic aciduria in their infants, methylmalonic acid is one marker, is actually a very reliable marker or indicator of vitamin B12 deficiency. So what these authors indicated in the title is that when vegetarian women have low vitamin B12 in their milk, okay, their infants that are breastfed develop high or elevated methylmalonic acid, which again indicates vitamin B12 deficiency. Let's consider this particular quote. At milk concentration less than 362 picomoles per liter, a biochemical deficiency of vitamin B12 may occur in infants. Now I want to focus on the graph on the left side of the screen. Notice that on the horizontal axle, we have maternal serum vitamin B12. And notice that as maternal serum vitamin B12 drops, which is indicated by this arrow, milk vitamin B12, represented by the vertical axle, drops also. Okay, so the lower the serum B12, the lower B12 in the milk, which would be something we would assume. I also would like to point out this red line indicates this value that we read from the quote, 362 picomoles per liter. Notice that we have on this slide open or blank squares, and these squares actually represent the milk vitamin B12 value of specific pregnant, or the lactating, I should say, lactating vegetarian women. And notice with just one exception, all of these women had vitamin B12 value in their milk that was lower than this value of 362, which, according to the quote, could potentially cause a deficiency in breastfed infants. I also would like to point out that according to this data from the same study, the longer a female was a vegetarian, which is indicated here on this horizontal axle in months on a vegetarian diet, the lower milk vitamin B12 level, again indicated in the vertical axle. And so what this shows is that inadequate intake, which is usually the case for vegetarians, translates into low milk concentration of this particular vitamin. Now, what potentially could happen? I would like us to keep in mind the quote that we read already. At milk concentration less than 362 picomoles per liter, a biochemical deficiency of vitamin B12 may occur in infants. What potentially impact would this have on infants? Well, let's answer this question by quoting from another manuscript that was published in the European Journal of Pediatric Neurology in 2010. Clinical presentation and metabolic consequences in 40 breastfed infants with nutritional vitamin B12 deficiency. Here's the quote. Cobalamin deficiency in infants is mostly nutritional due to low levels of vitamin B12 in the milk of their cobalamin deficient but still asymptomatic mothers. Cobalamin is the proper name of vitamin B12. So when they say cobalamin deficiency in infants, they are really saying vitamin B12 deficiency in infants. And they are stating that this deficiency is really related to what? To vitamin B12 level in the milk, which we pointed out based on the previous manuscript, that vegetarian pregnant women or lactating women would have a low value of, okay? Now, these women may be asymptomatic, as indicated in this quote, which actually would be most of the time the case. So there will be no events, uneventful pregnancy, the baby is born fine, but then within a few weeks or few months of breastfeeding, things might happen to the infant. Let's notice another quote. The clinical impairment of a mature nervous system develops slowly in months or years. When these researchers stated mature nervous system, they are referring to an adult, okay? So in adults, clinical impairment may develop relatively slowly, okay? It could take even years. This contrasts with cobalamin or vitamin B12 deficiency in infants who undergo extensive growth and development of the brain. Cobalamin deficiency may cause severe impairment in only a few weeks, okay? And in fact, in my next presentation, I will introduce you to what actually could happen in the infants. And again, I'm not saying here, and these researchers do not say that this will have to happen or will always happen, but potentially what could happen, the developmental delays and impairments in terms of behavior in infants that are documented in the literature. For more information, I would like to refer you to my new book, Vegan Vegetarian Mother and Her Baby, and to obtain a copy or learn how you can obtain a copy, you can contact me at this email provided here.